Hello, good morning again. Just Patrick coming here to you live from Complete Health Eastbourne. And just wanted to talk about a topic that gets kind of thrown around a lot in our profession, which is the use of drugs and the uses of medicine. And when is the right and wrong time to use medicines or use drugs? Because what we have to understand about all types of therapy, all types of care, is that there's a right and a wrong use for all of these different types of therapy, and medicine is one of those. Now, medicine really is designed, if we look at the way that our health service is designed, it's very much designed for emergency-based care and sickness-based care. So when something goes seriously wrong. So really our health service in this country is very much designed and set up for extremely complicated neurological conditions, heart attacks, diabetes, cancer, etc. But when you look at the actual setup of our NHS, it's not necessarily set up particularly well for people with musculoskeletal issues. So things like lower back pain, tennis elbow, knee injuries, etc., etc., etc. And the only option that medicine seems to provide for those people is painkillers and surgery. Now, there are tons and tons more options there for people in those states. Now, there is a right and a wrong time to use medicine or drugs or pills. And we have to understand that if we are using medicine as a crutch, as opposed to a way of managing something until we can correct the cause, that's different. Because if you've got high blood pressure or high cholesterol, or you've got a type 2 diabetes, and you have to come on a drug to lower those things. So if you have to have a drug to lower your blood pressure, there are so many aspects in our life and in our diet and in our lifestyle that we can actually change, that we could naturally change those things anyway. So if someone could change the volume of stress and change the volume of salt and change the volume of fat and change their volume of exercise in their life, is it safe to say that their blood pressure could actually change? And we all know the answer, that if we're leading a healthy lifestyle, that our blood pressure is affected by that. One of the other things that we know is that 1 in 2 people are predicted to have cancer nowadays, whereas it never used to be like that. We only go back 50, 60 years and it was predicted 1 in 4. So what's the reason why we're doubling these rates? Now, it's not to say that medicine are doing anything wrong, but there is also some ways that we can actually potentially enhance the lifestyle. And actually there are a lot of new initiatives that are going in, and there is a lot of money being spent in the NHS, because what we know is our health service is starting to become more and more expensive, because so many people are having to use medications just in order to keep themselves going, as opposed to in the past, whereas people statistically only ever went to go and see their doctors over the age of 40, 50, 60. That was when things went wrong. However, nowadays, we have so many more people going in with high blood pressure, obesity, cancers in their 20s and 30s. And what we've got to start asking ourselves is why? And what is it that's changed in the 21st century that's actually causing for people to actually need these things from their NHS? Why are we having high blood pressure in adolescents and teens and young adults, as opposed to only in the over 60s? And one of the biggest things that has changed for us is the lifestyle factors that are going on around us. There are so many people not managing to do the volumes of exercise that they would have done. There are so many people not actually eating an adequate diet. There's too much grain. There's not enough of the right fats. And so as a result, what we're starting to see is a huge influx on people actually needing our health service. And as a result, this is why we're seeing such a high stress load on our NHS at the moment, because people have not got the ability to take care of themselves. So know the times to use medicine. And really the times to use medicine is in emergency cases. Like I say, heart attacks, cancer, etc. And by the way, I'm not saying don't get checked if something's going wrong, but understand that you can do something for yourself. You can do something for yourself in order to actually manage these conditions before they actually become serious, before they become a problem. And if we are diagnosed with something like marginally high blood pressure, start looking at the ways that you can naturally change those things, because there are natural options, and ask your doctors and GPs for what are the natural options in these cases. Because even if you are going to take the medication, which is fine, by the way, if you're going to take the medication, which is fine, but also look at the factors that you can use in order to lower things like your cholesterol, your blood pressure, maybe improve your insulin dependence if you've been diagnosed with type 2 diabetes. And if your doctor's not willing to discuss those things with you, please give us a shout, because I'm absolutely happy to discuss the physiology of how diabetes is affecting our bodies, why our blood pressure gets high, why our heart becomes stressed when we don't get a volume adequate of exercise, and when we don't eat the right diet. So I'm happy to discuss those things with my patient, because we were trained in physiology, biochemistry, and nutrition. So I'm comfortable recommending those pieces of information to people in order to actually help reduce the volumes of stress on our NHS, and reduce the volumes of stress on people's bodies, not just naturally on back pain, but on all aspects of their life. Guys, if you've got any questions, obviously just drop them below. It's very nice to see you all this morning. Good morning, Laura. Nice to see you too. And I will speak to you guys again very, very soon. Take care. Ciao.